LSD. LSD, Lysergic Acid Diethylamide. What is LSD? LSD, Lysergic Acid Diethylamide, is a synthetic, man-made, drug that has been abused for its hallucinogenic properties since the 1960s. If consumed in a sufficiently large dose, LSD produces delusions and visual hallucinations that distort the user's sense of time and identity. Other hallucinogens include psilocybin, magic mushrooms, shrooms, mescaline, peyote, buttons, cactus, Phencyclidine, PCP, angel dust, Ayahuasca, DMT, Salvia divinorum, Salvia, Ecstasy, MDMA or Molly. How is LSD abused? LSD generally is taken by mouth. The drug is colorless and odorless but has a slightly bitter taste. Who uses LSD? Individuals of all ages use LSD. Data reported in the National Household Survey on Drug Abuse indicate that an estimated 20.2 million U.S. residents aged 12 and older used LSD at least once in their lifetime. The survey also revealed that many teenagers and young adults use LSD. 742,000 individuals aged 12 to 17 and 4.5 million individuals aged 18 to 25 use the drug at least once. LSD use among high school students is a particular concern. More than 8% of high school seniors in the United States use the drug at least once in their lifetime. Nearly 4% use the drug in the past year, according to the University of Michigan's Monitoring the Future survey. The effects associated with LSD use are unpredictable. It depends upon the amount taken, the surroundings in which the drug is used, and the user's personality, mood, and expectations. Some LSD users experience a feeling of despair, while others report terrifying fears of losing control, going insane, or dying. Some users have suffered fatal accidents while under the influence of LSD. LSD users often have flashbacks, during which certain aspects of their LSD experience recur even though they have stopped taking the drug. In addition, LSD users may develop long-lasting psychoses, such as schizophrenia or severe depression. LSD is not considered an addictive drug, that is, it does not produce compulsive drug-seeking behavior as cocaine, heroin, and methamphetamine do. However, LSD users may develop tolerance to the drug. It means that they must consume progressively larger doses of the drug in order to continue to experience the hallucinogenic effects that they seek. The most common names for LSD are acid, boomers, and yellow sunshine. Is LSD illegal? Yes, LSD is illegal. LSD is a Schedule I substance under the Controlled Substances Act. Schedule I drugs, which include heroin and MDMA, have a high potential for abuse and serve no legitimate medical purpose. What does it look like? In its pure state, LSD is a white odorless crystalline substance. However, LSD is so potent that an effective dose of the pure drug is so small, it's virtually invisible. As a result, it's usually diluted with other materials. The most common form is drops of LSD solution dried onto gelatin sheets, pieces of blotting paper or sugar cubes, which release the drug when swallowed. LSD is also sometimes sold as a liquid, in a tablet or in capsules. LSD is believed to be one of the most potent mind-altering compounds discovered to date. LSD causes hallucinations, distortions, and an altered experience of senses, emotions, memories, time, and awareness. There can be distortions of sensory perception such as synesthesia, the experience of additional spatial or temporal dimensions, and temporary dissociation. Lysergic acid diethylamide, LSD, is synthetically derived from the fungus, Claviceps purpurea. Several isomers of this compound exist, although only the D isomer is considered active. LSD was first synthesized by Albert Hofmann in 1938 in a search for an analeptic drug. After finding its psychogenic activity, it was marketed by Zondas Laboratories under the name Delisib. It was also reportedly used by the Central Intelligence Agency as a tool for interrogation. Due to its potential for bad trips, flashbacks, and potential risk for brain injury, LSD was banned federally in 1966 and is currently only used illicitly. LSD is chemically similar to other naturally occurring lysergamides found in multiple species of morning glory. ISPP. Lysergic Acid Diethylamide, LSD, is readily synthesized in illicit laboratories. Although it is generally a mix of 4 stereoisomers of which only one, L-iso-LSD, has hallucinogenic activity. Synthesis of pure LSD that is predominantly this isomer, with little of the other 3, is technically difficult. Dogs in particular may eat sufficient quantities of the seeds of morning glory, ISPP, to have apparent hallucinations. The form of lysergic acid in morning glory seeds is lysergic acid hydroxyethylamide, which is estimated to be only 1/10 as potent as LSD. Lysergic acid diethylamide, LSD, is the best known drug of a subtype of hallucinogens, commonly referred to as psychedelics. LSD is by far the most potent psychedelic and one of the most potent psychoactive substances ever discovered. Although LSD was a popular recreational drug in 1960s, today its abuse is less common. A moderate dose of 75 to 150 g of LSD can produce psychedelic effects. Optimum dosage used for recreational purpose is 100 to 200 g. Traumatic experience, bad trips, may also occur from LSD abuse. LSD also alters the state of consciousness as well as impairing psychomotor functions. The biochemical action of LSD is due to its partial agonistic property of serotonin receptors 5-hydroxytryptamine, 5-HT, especially 5-HT2A receptors. Although LSD abuse can result in severe toxicity, there is no documented death due to abuse of LSD alone. LSD is completely absorbed after ingestion and psychological effects are observed 30 to 45 minutes after ingestion. In humans, LSD is also rapidly metabolized into structurally similar metabolites. Major metabolite. The major metabolite is 2-oxo-3-hydroxylysergic acid, which is present in human urine 16 to 43 times greater than LSD. The oral bioavailability of LSD was determined to be 71%. After ingestion of LSD, maximum plasma concentrations could be reached 1.5 hours, median value. The major metabolite detected in urine was 2-oxo-3-hydroxylysergic acid diethylamide. Similar to active ingredients of magic mushroom and peyote cactus, LSD also binds to serotonin receptor. Studies have shown that serotonin 2A receptor, 5-HT2A, is critically involved in the formation of visual hallucinations and cognitive impairment in LSD-induced states. Moreover, activation of 5-HT2A receptor by LSD leads to a hippocampal prefrontal cortex-mediated breakdown of inhibitory processing, which might subsequently promote the formation of LSD-induced visual imageries. A common side effect of LSD is the unpredictable recurrence of hallucinations for weeks or months after the last dose. Hysterical behavior, hyperactivity, and life-threatening hyperthermia are exhibited in some cases. The onset of effects is rapid, within 5 to 10 min, with psychosis evident after 15 to 20 minutes. Peak effects occur 30 to 90 minutes after dosing, and they decline after 4 to 6 hours. The duration of effects may be 8 to 12 h. What are the effects? LSD can produce a range of short-term psychedelic and physical effects, but guessing which ones you'll experience is a bit of a crapshoot. The combo of effects varies from person to person and even from one trip to another. Physical effects can include dilated pupils, rapid heartbeat, palpitations, elevated blood pressure, increased body temperature, flushed skin, sweating, tremors, tingling in the fingers and toes, dry mouth, dizziness, blurred vision, loss of appetite, nausea. Mental effects include 1. Visual hallucinations, which can involve intense flashes of light and distorted images in reality. 2. Intensified senses, including smells, sounds, and sensations. 3. Feeling detached from your body or like you're having an out-of-body experience. 4. Blending of sensory perception, synthesis, like hearing colors or seeing sounds. 5. Distorted sense of time and environment. 6. Feelings of euphoria. 7. Paranoia and delusions. 8. Mood swings. 9. Anxiety and panic, and 10. Fear. Any other potential interactions? The effects of any substance get pretty unpredictable when you start mixing, so before taking LSD, it's important to know how it might interact with anything else you're taking. This includes prescription medications and other substances. Prescription medications. LSD can lessen the effects of certain prescription medications and prevent them from working properly. Some known LSD and prescription medication interactions include 1. Selective serotonin reuptake inhibitors, SSRIs. 2. Monoamine oxidase inhibitors, MAOIs. 3. Benzodiazepines. Keep in mind that LSD may interact with medications in ways that experts haven't yet identified. Other substances. When you mix LSD with other substances, the effects of either or both can be increased. While not every substance has been studied for potential interactions with LSD, we know that mixing it with any of the following can have unpleasant and potentially harmful effects. Shrooms, MDMA, ketamine, DXM, cough syrup, cocaine, cannabis. Is there a risk of addiction? LSD isn't considered an addictive substance, according to the National Institute on Drug Abuse, but you can develop a tolerance to it and other hallucinogens if you take it often. When tolerance happens, you need more of the drug to achieve the same effect. This increases the chances of bad trips and long-term effects. What about other risks? LSD can produce long-term effects in some people. Your chances of experiencing long-term effects, including persistent psychotic symptoms, is higher. If you ingest large doses of acid or have a pre-existing mental health condition, such as schizophrenia. Long-lasting effects are also possible after a bad trip. Some people find it hard to shake off a bad trip and have trouble adjusting to reality, even long after the LSD's effects have worn off. Another potential long-term effect of LSD is a condition called hallucinogen persisting perception disorder, HPPD. People with HPPD experience recurring hallucinations and other effects of LSD for weeks or even years. These experiences are called flashbacks. There are also risks related to the intense effect LSD has on your mood and perception of reality. Hallucinogens like acid can make you do things you wouldn't normally do. For some folks, it causes extreme mood swings that may lead to aggressive and violent behavior. Recognizing an overdose. A fatal overdose from LSD is unlikely, but adverse effects that require medical intervention are possible, especially when someone takes a large amount. Emergency signs. If you or someone else experiences any of the following after taking LSD, go to the nearest emergency room, or call 911 or your local emergency services. 1. Shallow or irregular breathing. 2. High body temperature. 3. Agitation or aggression. 4. Irregular heartbeat. 5. Hallucinations or delusions. 6. Seizures. 7. Chest pain. 8. Loss of consciousness. What are the short-term effects on the brain? LSD influences serotonin receptors in the brain. Serotonin is a neurotransmitter that plays a role in every part of your body, from your mood and emotions to your motor skills and body temperature. According to a 2016 study, LSD also causes changes in the brain's blood flow and electrical activity. The same study also suggests it increases areas of communication in the brain. Together, these effects on the brain can result in 1. Impulsiveness. 2. Rapid mood changes that can range from euphoria to fear and paranoia. 3. Altered sense of self. 4. Synesthesia, or a crossing of the senses. 5. Increased blood pressure. 6. Fast heart rate. 7. Increase in body temperature. 8. Numbness and weakness. 9. Hallucinations. 10. Sweating. 11. Tremors. What about long-term effects? So far, there's not much evidence to suggest that LSD has long-term effects on the brain. People who use LSD can quickly develop a tolerance and require larger doses to get the same effects. But even this tolerance is short-lived, usually resolving once you've stopped using LSD for several days. The big exception here is the association between using LSD and other hallucinogens and the development of psychosis and hallucinogen persisting perception disorder, HPPD. Psychosis. Psychosis is a disruption of your thoughts and perceptions, resulting in an altered sense of reality. It makes it hard to tell what's real and what isn't. You may see, hear, or believe things that aren't real. We've all heard stories about someone who took LSD, had a super bad trip, and ended up never being the same. Turns out, the chances of it happening are pretty slim. Psychosis. LSD and other substances can increase the risk in people who already have a higher risk for psychosis than others. A large survey published in 2015 found no link between psychedelics and psychosis. This further suggests there are other elements at play in this connection, including existing mental health conditions and risk factors. HPPD. HPPD is a rare condition that involves having repeated flashbacks, which are described as re-experiencing some of the effects of the drug. They might include certain sensations or visual effects from a trip. Sometimes, these flashbacks are pleasant and feel good, but other times, not so much. The visual disturbances can be particularly unsettling and interfere with daily activities. In most cases, LSD-related flashbacks happen once or twice, usually within a few days of use, though they can also show up weeks, months, and even years later. With HPPD, however, flashbacks happen repeatedly. Again, it's thought to be pretty rare. It's hard to really know, given that people often aren't open with their doctors about their drug use. The cause of the condition is still unknown. People may have a higher risk if they, or their family members, already have anxiety, tinnitus, ringing in the ears, concentration issues, eye floaters. Lysergic Acid Diethylamide, LSD, is a classical hallucinogen. No approved indications for LSD-assisted therapy exist today. It has been used in the past for non-FDA approved indications. Depressive disorders including those with conversion phobia, neurosis, manic depression, and reactive depression, cyclothymic, obsessional, and passive-aggressive, obsessional, compulsive sexual deviation addiction. Psychoneurotic disorders, mixed, pan-neuroticism, including schizophrenia, borderline or latent and personality disorders, especially transient situational. This activity will highlight the mechanism of action, adverse event profile or toxicity, pharmacology, monitoring, and relevant interactions of LSD, pertinent for members of the interprofessional team should they encounter patients who misuse or have misused this drug. Lysergic acid diethylamide, LSD, is a classical hallucinogen originally synthesized by Albert Hofmann. He accidentally concocted the drug while making experimental substances from ergots to create circulatory and respiratory stimulants. The most pronounced effect on the animals allowed him to create a model for psychosis and study the induced temporary psychotic-like states. During the psychotic state, he also noted permitted recall and produced improved insight. In 1986, almost 400 patients received treated with LSD. The Danish LSD damages law was passed because of the crimes and deaths linked to LSD usage, where applicants received financial compensation for the harm resulting from the treatments. Many years afterward, patients still suffered from the side effects of being treated with LSD. Regulations. Regulations on hallucinogenic drugs started to be introduced in 1967 to limit the use of LSD and other hallucinogenic drugs to qualified practitioners. The hope was to eliminate or decrease risky behaviors and result in harmful consequences brought on by the drug. Despite these efforts, LSD-assisted treatments continued in some European countries in the 1970s. In Switzerland, psychotherapy and research were also conducted from 1988 to 1993 with special permission from their government. No approved indications for LSD-assisted therapy exist today. It has seen use in the past for non-FDA approved indications. Depressive disorders including those with conversion phobia, neurosis, manic depression, and reactive depression. Cyclothymic, obsessional, and passive-aggressive, obsessional, compulsive sexual deviation addiction. Psychoneurotic disorders, mixed, Paneuroticism, including schizophrenia, borderline or latent personality disorders, especially transient situational. Researchers continue to study the utility of LSD-assisted therapy. The following non-FDA approved indications show the most evidence for serotonin-based psychoactive agents. Substance use disorders, especially in treating chronic alcohol addiction. Post-traumatic stress disorder, anxiety, and depression in patients suffering from life-threatening illnesses. Combining LSD with counseling, researchers were able to create a psychedelic trip for the terminally ill, thereby decreasing the anxiety refractory to conventional anxiolytic therapy, depression, and pain associated with life-threatening diseases such as cancer. Sleep reportedly improved with terminally ill patients, and they were less preoccupied with death. Research has also begun to look at LSD as a possible treatment for Alzheimer's dementia and as a last resort for migraines or cluster headaches. This role is partly because patients have self-medicated using LSD off-label as an ablative therapy for treatment-resistant migraines and cluster headaches. Patients obtain the illicit psychoactive substances as a last resort. When patients use LSD as a treatment or a recreational drug, there are few if any reports of psychoactive effects. The effects were reportedly tolerable or avoided using minimal doses. LSD-assisted therapy has been shown to enhance suggestibility without hypnotic induction. It has shown the most improvement in suggestibility in neurotic and schizophrenic patients but the least in depression. Neural plasticity in the cortex and cognitive flexibility are possibly necessary for demonstrable improvement in suggestibility. When the primary care provider, nurse practitioner, internist, or pharmacist encounters a patient taking LSD, referral to a drug rehab facility is the recommended course of action. LSD has no medical benefits and is associated with several unpleasant psychiatric effects. In general, people who take LSD also take several other illicit drugs, and hence a urine screen is recommended. Unfortunately, LSD addiction is strong, and despite all therapies, success rates of treatments are low. In any case, the primary care provider should encourage the patient to cease taking LSD and/or avoid sharing needles and seek psychological assistance and treatment. In conclusion, and despite some controversial results mentioned above, LSD is revealed as a potential therapeutic agent in psychiatry. The evidence to date is strongest for the use of LSD in the treatment of alcoholism. Despite the difficulty of designing double-blind clinical trials with this substance, new studies performed under modern standards are necessary in order to strengthen our knowledge, help erase the stigma that still prevails around these substances and open new doors in the future.